Hello everyone, here we have a follow-up patient of ours. When I say follow-up, a lot of our subscribers, all of you, often have query as to how does the patient look, say 6 months from the surgery or 4 months or a year after the surgery. Very rarely patients can take time out from their schedule, come back to the hospital, report to us. Here we have one such patient who has come again, but this time for a different treatment. He says there was lockdown in between, that is the reason he could not follow it up with us. To brief you, we had done a lip revision surgery. That was because he had a scar over his upper lip. The scar was because of a blister, as he says, or a small pimple which he had in his childhood, which enlarged and gave him an ugly hypertrophic scar which was there at his upper lip. We'll go on to show the pictures. So this is how he presented to us in November. This was the scar which he had on his upper lip, starting from the philtrum towards the left of the philtrum, I would say, and ending at the lip. Now this has completely obscured his lip because there was no white roll. The cupid's bow was camouflaged by the hypertrophic scar that he had. It was quite ugly. When he came to us, we told him the option of lip revision and of scar revision basically at that region. So this is how he looks right now. It was done November 2020 to now, which is say August 2021. Right? We have done a right roll match, that is a cupid's bow. The shape of the upper lip has been restored. The skin there, yes, does remain a little hypertrophic, but all the ugly scarring and the bands that he had has been removed. Now the problem that he has is deficient hair and that area. So his mustache is missing because there was a scar that has been repaired. So we are planning for a mustache transplant for him. Not only we are planning to insert hairs using the FUE technique, also as he mentioned, he has not a leveled mustache on either side. So he feels the right side is broader, it's longer as compared to the left side. So all that minute correction will be done. Hair can be restored. Mustache transplantation happens to be a very beneficial technique in all male cases. It can hide any of your upper lip scar, and it's a very feasible technique. We follow the FUE technique, which is follicular unit extraction technique. The grafts are harvested from the occipital area. They are implanted, slots are made, and they are implanted over the mustache. Fewer follicles will be needed, but the results will be lifelong, and it will be a very feasible, economic, I would say the most practical option for his case. Yeah. How has been like post scar revision up till now? Any complication that you faced? कुछ तकलीफ हुई आपको? नहीं. नवंबर में हुई थी, राइट आपका? नवंबर एंडिंग में. ओके. उसके बाद आपको दवाई वगैरह सब दिया गया होगा. एनी एपिसोड ऑफ ब्लीडिंग? नहीं. एनी पेन? कुछ नहीं. ओके. अभी आपको तभी से ही मुस्टैच ट्रांसप्लांट करवाना था, लेकिन आप आ नहीं पाए बीच में, आपने ऐसा कुछ बताया. ओके, ठीक है. अभी स्पेसिफिकली क्या क्या चाहिए आपको मुस्टैच ट्रांसप्लांट में? ये जगह पे नहीं है मुस्टैच, दिख रहा है मुझे, वो करना पड़ेगा. दोनों साइड का आपको थोड़ा लेवलिंग भी करना है, राइट?
डॉक्टर
okay, fine. Okay, so here we have a follow-up, and it's always good to discuss follow-up cases because the viewers can understand that how the after results are. Say 6 months, 4 months, in his case almost 8 to 9 months, right?
8 months.
8 months. And then he is also willing for another procedure that will only that will hide existing scar. I would say not the bands have all disappeared, but that existing empty patch that he has, it will give him a normal appearance because the mustache in especially males act as a very good camouflaging option. Yeah. Okay, this is going to be a local anesthetic procedure, and it will take some time, but not much because he has a small patch of deficient hair. Okay, thank you.